Hello, I'm Dr. Rumana Dowla, and I'm here today to discuss a little discussed topic that is close to my heart, advocacy. Advocacy as an essential leadership skill. And in this thought, I stand in line with my other advocacy focal points who have been leaders like Zippy, Nicholas, Sophia. Now, what is advocacy? Advocacy for health policy is defined as the processes by which the actions of individuals or groups attempt to bring about social and/or organization change on behalf of a particular health goal, program, interest, or population. Health advocacy includes educating policymakers and the public about evidence-based policy. Advocacy is needed to inform, educate, inspire our politicians, and nurture political will, who in turn can influence to commission national policies, which ensures clinical delivery and ensures healthcare delivery at the grassroots level. Advocacy ensures dialogue with all these stakeholders and more. We must remember, most of our patients cannot speak for themselves. They often cry alone in pain. We are the voice of the voiceless. Now I'm sharing with you various platforms which have been our great support. All these platforms have influenced our growth as a leader in palliative care. I will explain a bit on some of these. Palliative care champions from low and middle income countries often need guidance from their predecessors from other countries. In this field, who have been pioneers in their countries. These platforms have been immense help in creating leaders, enabling them in planning how, when, what, and with whom. Leadership Development Initiative has been such platform in bringing out the best in each of its mentees. I'm proud to be one of them. And many of us are in this today's Congress. And on the other hand, IHPC, International Association of Hospice and Palliative Care, has been the platform where we could apply our skills, including advocacy, to influence and bring about major changes in our countries and United Nations and WHO meetings, World Health Executive Body meetings, in World Health Assemblies. We work together to bring about changes. It has been taken up by IHPC with global multidisciplinary cross-section of experts who developed a 5-year strategic plan for 2020-2024, identified 4 mutually reinforcing areas of work. It is generally agreed that most important of which is advocacy. And advocacy focal points were chosen based on presence of palliative care champions who is a member of IHPC, a relatively stable government receptive to civil society advocacy, some availability of opioids for pain relief and palliative care, membership of the WHO Executive Board and/or membership of Commission on Narcotics. If I may add, there are about 13 advocacy focal points, and 4 of us have been with Leadership Development Initiative. And who are presenting this, actually. This is our thought together to you, that advocacy is essential. The role of IHPC advocacy focal points was to support the global development of palliative care and foster its development in their own countries by building relationships with their national policymakers, communication professionals, related organizations, and academia. there we are. Together, along with our mentors, we have moved from strength to strength, inspiring each other, staying resilient, and ensuring sustainability of palliative care in each of our countries, and continued the global movement of palliative care. If I may add, some of our countries have just had, during the pandemic, we have actually compiled and completed a guideline and also presented to our ministry. Some of us have changed policies in UN platforms and WHO platforms while being with each other and imbibing in strength. Also through innovations, advocacy used platforms, these digital platforms and telemedicine in palliative care. When the pandemic created challenges that were faced full on. Digital platforms, innovations enabled us to advocate, making sure we are leaving no one behind. The theme of this World Hospice and Palliative Care Day. Also, I'm sharing with you that advocacy is the way we move forward through national and international crises. Some of my colleagues have mentioned already how they have changed things, and major changes have happened which wasn't happening for so long. Pandemic, the crisis gave us opportunity. Leadership skills ensures we do not give up. We face challenges. We continued in adverse situations to treat, to encourage, and be beside our patients to help us move forward together. The picture I shared is on Mother's Day. All of us are either lady doctors or nurses working together. 20th, I think 6th May 2020. I take the challenge with each one of you, my fellow advocacy focal points, to engage and conquer, once again, leaving no one behind. I'm mentioning Zipporah, Sophia, Nicholas, and Farzana here because we have done the leadership course and we feel the importance of advocacy, like most of you do. And we want to work towards global palliative care movement and closing the gap. Then again, I would like to acknowledge my mentors who helped me develop my leadership skills. Frank, Ron, you just made even this presentation better than what it would have been. Thank you. And Liliana, Catherine, for enabling us with the platform. This helped me become a better advocate in bridging the gap, leaving no one behind. It's a pleasure to be with you again.